Hi friends, welcome to our YouTube channel, One and Only Pharmacy. So friends, today we are discuss about Pharmacology chapter, Parasympathomimetics or Cholinergics. So friends, please watch this video till the end. Let's start. Topics cover under this video. Which topics we are discuss about today's lecture? Definition, classification of parasympathomimetic, acetylcholine means detailed study of acetylcholine, ADME or uses of acetylcholine, and last one organophosphorus poisoning. In this chapter, we detailed study of acetylcholine and organophosphorus poisoning. Let's start with one by one in detail. Parasympathomimetics. What is the definition of parasympathomimetics? These are the drugs which these are the drugs which produce action similar to that of parasympathetic stimulation. Example acetylcholine and pilocarpine. Classification of parasympathomimetics. Parasympathomimetics mainly divided into four main types, which are esters of choline, synthetic compound, natural alkaloids, and last one anticholinesterase. In esters of choline, example of esters of choline, acetylcholine, methacholine, and carbachol. In synthetic compound, example futrethonium. In natural alkaloids, example pilocarpine, muscarine, paracolin, etc. Anticholinesterase again divided into two subtypes, reversible anticholinesterase and irreversible anticholinesterase. In reversible anticholinesterase, example of drug physostigmine and neostigmine, and in irreversible anticholinesterase, organophosphorus compound. These are the very simple classification of parasympathomimetics drugs. Next point, esters of choline. Example, acetylcholine. It is available in powder form. It gets hydrolyzed in alkaline or neutral media. Hence, it is preserved at acidic pH. At an acidic pH. Pharmacological actions of acetylcholine. What is the pharmacological actions of acetylcholine? These are follows. There are two actions. There are two pharmacological actions of acetylcholine, which are muscarinic action and nicotinic actions. In muscarinic action, that is actions on heart, GIT, respiratory system, etc. And nicotinic actions includes actions on skeletal muscle and autonomic ganglia. Let's see one by one action in detail. Actions on heart or CVS means in cardiovascular system. Acetylcholine decrease the activity of heart. It decreases the blood pressure due to vasodilation. It decreases the force of contraction of heart. Next action on smooth muscles of GIT. Acetylcholine causes the increase in the contraction of intestinal smooth muscles, which leads to increase in peristalsis, that is GI motility. Hence, it can be used in the treatment of atony. What is atony? Atony means loss or absence of peristalsis. Action on respiratory system. What is the acetylcholine action on respiratory system? Acetylcholine produces contraction of bronchial muscles and leads to apnea. What is apnea? Difficulty in breathing. Hence, acetylcholine contraindicated in asthma. Action on eye. Action on eyes. Acetylcholine produces miosis, that is, decrease in pupil size. Hence, it can be used in the treatment of glaucoma. Action on glands. Acetylcholine increases gastric, intestinal, salivary, pancreatic, lacrimal, respiratory, and sweat secretion. Action on skeletal muscles. Acetylcholine increases the contraction of skeletal muscles. Acetylcholine increases the contraction of skeletal muscles. Hence, it can be used in the treatment of myasthenia gravis. Myasthenia gravis means weakness of skeletal muscle, but sometimes it may lead to paralysis. These are the actions of acetylcholine on different parts of the body. ADME of acetylcholine means absorption, distribution, metabolism, and excretion of acetylcholine. On oral administration, acetylcholine get destroyed in GIT. On injection, it does not give much more action as it gets hydrolyzed by the enzyme cholinesterase in the blood plasma. What is the therapeutic uses of acetylcholine? These are follows. Acetylcholine used in the treatment of glaucoma, in the treatment of myasthenia gravis, in the treatment of tachycardia, means increase in heart rate, in the treatment of atropine poisoning, in the treatment of post-operative paralytic ileus, and in the treatment of atony. These are the simple uses of acetylcholine in day-to-day life. Myasthenia gravis. What is myasthenia gravis? And sometimes ask the question in question paper. Write a short note on myasthenia gravis. It is a disease characterized by easy fatigability and progressive weakness of skeletal muscles. Generally, you remind myasthenia gravis means weakness of skeletal muscles. It is an autoimmune disease caused by deficiency of postsynaptic neuromuscular acetylcholine receptor complex. It is an autoimmune disease caused by deficiency of postsynaptic neuromuscular acetylcholine receptor complex. Neostigmine is used in the treatment of myasthenia gravis. Sometimes asked the question which drug is suitable for the treatment of myasthenia gravis or choose the drug for myasthenia gravis. The correct answer is neostigmine. Adverse effect of acetylcholine. Acetylcholine having many adverse effects which are as follows: nausea, vomiting. These are the general adverse effects of any drugs. A main adverse effect of acetylcholine is apnea, means a difficulty in breathing, salivation, spasm of accommodation, sweating, bradycardia, hypotension, and cardiac arrest. These are the adverse effects of acetylcholine. Cholinesterase inhibitors or anticholinesterase. Definition: these are the drugs which inhibit the enzyme cholinesterase, means anticholinesterase, and leads to accumulation of acetylcholine in the body. Example: organophosphorus compounds, physostigmine and neostigmine. Let's see organophosphorus compounds in details. These compounds are powerful inhibitors of enzyme cholinesterase and leads to accumulation of acetylcholine in the body. Because of their high toxicity, they are not used therapeutically but are used in the agriculture as an insecticide. Organophosphorus poisoning. The causes of organophosphorus poisoning. There are three causes of organophosphorus poisoning. First one suicidal, second occupational, and three accidental. In suicidal, due to intentional ingestion of organophosphorus compounds, and in occupational, it takes place in the person who is engaged in spreading of insecticide. And generally, in insecticide, organophosphorus is present. Accidental, it is due to the eating of agriculture products sprayed with these insecticides. These are the three causes of organophosphorus poisoning. Next point, treatment of poisoning. There are two main treatments. First one, general treatment, and second, specific treatment. In general treatment, gastric lavage. Gastric lavage means in this treatment, the compounds in this treatment, the contents of GIT wash out, that is, washing out of organophosphorus compounds. Administration of IV fluids, removal of salivary and pharyngeal secretions, nursing care, etc. under the general treatment. And in specific treatment, it includes administration of pralidoxin injection. It includes administration of pralidoxin injection. Antidotes used for organophosphorus poisoning. Generally ask the question, what is the antidote used for organophosphorus poisoning, or choose the following is the antidotes used for organophosphorus poisoning. There are many choices, different, but correct answer is pralidoxin injection and atropine injection. Thank you guys for watching full videos. Let's see again which points we are today cover. Topic one by one. Topics covered under this video: definition, classification, acetylcholine, ADME of acetylcholine, organophosphorus poisoning, parasympathomimetics, definition of parasympathomimetics. These are the drugs which produce action similar to that of parasympathetic stimulation. Example: acetylcholine and pilocarpine. Classification: there are four main classes: esters of choline, synthetic compound, natural alkaloids, and anticholinesterase. In this chapter, we are mainly discuss two drugs. First one, esters of choline, example acetylcholine, and second next drug is organophosphorus compound, means irreversible anticholinesterase. Esters of choline, acetylcholine. Pharmacological actions of acetylcholine: there are two actions of acetylcholine: muscarinic action and nicotinic action. Actions on heart: action on smooth muscle, action on respiratory system, action on eye, action on glands, action on skeletal muscles. ADME of acetylcholine. Therapeutic uses of acetylcholine. Myasthenia gravis. Adverse effects of acetylcholine. Cholinesterase inhibitors or anticholinesterase. These are the drugs which inhibit the enzyme cholinesterase and leads to accumulation of acetylcholine in the body. Example: organophosphorus compounds, physostigmine, neostigmine. Organophosphorus compound. What is organophosphorus poisoning? Causes of organophosphorus poisoning. Treatment of poisoning. There are two main treatments: general treatment and specific treatment. Specific treatment, pralidoxin injection is given by the patient. Antidotes: pralidoxin injection and atropines. Friends, if you like this video, then please like, share, and subscribe to our YouTube channel for daily updated pharmacy related videos. Thank you, friends. Let's meet next videos.